So now we're going to go ahead and practice what I call the out-of-plane control tip method. Now this allows us to see the needle tip using the out-of-plane technique. It takes just a little bit more skill. Now, and mainly practice. The one thing that it helps us do is hit the middle of the blood vessel to avoid, especially during central line insertion, the old hung up guide wire. We hate that, right? So let's go ahead and we're going to find our vascular structure. Here it is right here. And now what I'm going to do is I'm going to find an area without too many needle tracks. All phantoms will track. Now I'm going to go ahead and just like the control or the dead reckon technique, I'm going to put my needle two millimeters away from the probe at a 45-degree angle. And I'm going to go ahead and enter the phantom. And when I do that, I can go ahead and I'm going to start to see my needle tip right there. Now I may have to slide a little bit towards the needle or away from the needle to find it. Now I see this little orb. I'm going to go left and right. And I'm going to slide the probe away from me until it's gone. Right there it is. By the way, I only moved about 0.5 millimeter with the probe. All right, so here it is. Now what I'm going to do is I'm going to advance both at the same time. Now I do have a needle track right there, but it's going to go away. Now, to be safe, occasionally I'm going to go ahead and slide my non-dominant hand away until it's gone. Why? The little orb is gone. I want to make sure I'm actually looking at the tip and not part of the shaft. I do not want to have an unexpected contact with any structure, whether it's an artery, a vein, or a nerve. All right, so here's our tip again. Again, I'm going to tick-tock back and forth, left and right. Don't do that on your patient. And now what I'm going to do is just make a little bit of a redirect. I'm going to go to the right with the needle, which is on the screen, going to make it go to the left. And I want to go right in the middle of the target, what I call the apogee, or the highest part of the vascular target, typically the anterior surface. And now I can feel it on the top, and I'm going to go ahead and enter through. Now, I'm going to go ahead and continue to slide my probe distal, and I see what sometimes is referred to as a target sign with the needle inside of the blood vessel.